I'm Dr. Samith Shetty, practicing diabetologist from Chennai, India. Today I'll be speaking to you about diabetes and cardiovascular disease. Why are we all talking about diabetes quite often now? It is because diabetes is reaching epidemic proportions all around the globe with much higher rates in Asian countries. Predominantly, it is in higher proportions in Middle East, Southeast, China, as well as Indian subcontinent. China holds the number one position for people having diabetes, followed by India. Now, why is it diabetes so important public health issue? It is because people living with diabetes have other complications associated with it, which are predominantly microvascular and macrovascular complications. The microvascular complications are retinopathy, which affects the blood vessels of the eye, nephropathy, which affects kidney, leading to end-stage renal disease, to kidney failure, neuropathy, affecting the nerves of the body. Macrovascular complications affect the larger blood vessels in the body, supplying the heart, the brain, the legs. If the heart blood vessels get affected, they cause coronary artery disease. If it affects the brain, it causes stroke, and if it affects the peripheral blood vessels, it leads to reduced blood supply to that part, leading to vascular diseases pertaining to that area. Now, why is this disease so common? There are a constellation of risk factors in a patient with diabetes, and also one more important evidence stating that people with diabetes have a 2 to 4 increased fold of developing coronary artery disease. Now, let me list out some of the most important cardiovascular risk factors in patients with diabetes. They are age, sex, cigarette smoking, uncontrolled blood sugar, hypertension, obesity, dyslipidemia, excess alcohol intake, and not to forget family history of coronary artery disease. And why is that we need to treat this important disease which affects people with diabetes? It is because coronary artery disease causes the highest level of mortality and morbidity in patients living with diabetes. So, is it possible to prevent this menace in people with diabetes, or if it is affected, how can we reduce the mortality and the morbidity associated with it? This is very much possible through very simple, effective, practical and preventive measures. Them being telling the patient about following a good lifestyle, educating them about quitting smoking, and giving counseling them about diet, lifestyle choices, reduction of alcohol, and also tobacco cessation. To add on to that, we should also start keeping a patient's diabetes control under HbA1c of less than 7 or around 7, as evidenced by lot of studies which shows that keeping HbA1c at level of 7% prevents lot of complications associated with diabetes. Along with that, we need to keep the blood pressure at a target of less than 140 by 90, as also the lipid levels should also be kept under normal. Now, which is the best time to do this? The best time to do this in a patient with diabetes is when the diabetes is newly diagnosed and they are young, because the disease has not exploited them. So it is the best time to act upon these people at that particular point of time and do the best to them, so that we can prevent people living with diabetes getting this menace in the future diseases. And also the patient should be advised to go for periodic health checkups annually or semi-annually as suggested by their treating physician. I hope this small bit of information was useful to you in your day-to-day living with diabetes. Thanking you. Bye. Dr. Samith from Chennai. Enough? போதுப்பா, இதுக்கு மேலே எனக்கு கையில் பண்ண முடியாது. எமர்ஜென்சி இல்லாமல் enough அப்பா? How many minutes?
2. No, the problem is this thing is saving is taking a while. It's 325 MB. It's taking a while to save.
You will put it in this?
Yeah.
Because I have to go. There is a patient who is calling me and messaged me.
Why is it not saving?
Sir.
பாருங்க சார்.
செருப்பு இந்த மாதிரி செருப்பல்ல.
ஸ்டக் ஆயிடுச்சு சார். சார்